Second week of pregnancy. Pregnancy symptoms in the second week. It is the second week of pregnancy, and you are still not pregnant despite all chances. What is the process of fertilization? Every 28 days, ovulation occurs. A mature egg is released from the ovary and travels to the uterus via the fallopian tube, where it awaits fertilization by a sperm cell. There is just around a 12-hour window during which the process of fertilization of the egg can take place, and if it does not, the egg leaves the body with some tissues and blood during the menstruation process. Because ovulation happens at the end of the second week and fertilization follows, a pregnancy test can be positive only 3 weeks after your last period. Is it possible that I am already pregnant? So yet, nothing has happened in regards to the fetus because, as previously said, it does not exist. Calculating the number of days until ovulation. Women who want to become pregnant, as well as those who are attempting to avoid pregnancy and utilize the safe days approach, need to be able to estimate when they will ovulate. Because the menstrual cycle can last anywhere from 21 to 39 days, the day of ovulation can be delayed for up to 2 weeks, beginning on the 7th day of a 21-day cycle and finishing on the 25th day of a 39-day cycle. Characteristics of ovulation days. The following are some of the traits that distinguish ovulation days. The passage of time. Menstrual bleeding occurs in the majority of women 14 days after ovulation, and because of the substantial variations between cycles, the average cycle duration must be computed using statistics from the previous 3 months, then 14 days subtracted. Although it is still difficult to predict the day of ovulation based on the start of the last menstrual cycle with adequate accuracy, the date can be estimated. Substances secreted. The shift in cervical mucus that generates varied secretions from the vagina can be followed, as in the days coming up to ovulation. The cervix secretes a low-viscosity mucus designed to allow the sperm to survive due to the action of estrogen. After ovulation, however, a highly viscous mucus is released with the intent of destroying sperm. Temperature of the body. The body temperature dips somewhat during ovulation, and this can be tested using a thermometer during the time when ovulation is supposed to happen.